Well, I was
So
asking where we were in the spring for the spring semester.
sure. So at Stony Brook, we actually started our semester on time. We started on Monday with our in-person classes as scheduled, and really just made sure we had all of the same safety protocols in place. So a negative test to return to campus, surveillance testing, vaccination, wearing face coverings, and now the new piece obviously is the booster requirement for our students.
And Janine, what's it been like for you?
Similar, we started on January 22nd. All of our residential students were required to have a negative test in order to move in. We've offered testing for all employees and students who are interested in having a test each week. Masks are required indoors, and we also have the booster requirement for our employees and our students.
So I guess what lessons have been learned, whether it's, trying to isolate students or, resources in terms of staffing? How have things changed and adapted, Rick?
Sure. Well, one of the important pieces, I think, with COVID, and we've learned quite a bit over the last 2 years, and particularly as advice changed from the CDC, we've kind of had to adapt and be flexible to make sure as isolation protocols changed, we were responsive to that. It really required building a big infrastructure. At Stern, we're a large university, and making sure that our number one priority of health and safety was always at the forefront. So building up our student health services team, the contact tracing piece, we've done all testing ourselves on campus, working with our hospital, our partners. So those have been really critical pieces to build up the infrastructure. And I think there were times we thought, well, maybe we wouldn't need that anymore, but we've fortunately kept that at play. And it's really allowed us to keep our infection rates particularly low. And we like to say that we really are an incredibly safe campus. And that has always been the number one priority for us.
And Janine, for you at Molloy, you have a smaller amount of kids who are staying there. So what is that like when you deal with so many people coming in?
Well, for our residential population, because we are rather small, we are very high touch. So if we do have a student who tests positive, we have a really nice relationship with a local hotel about 4 miles from campus. So we, make sure that the student is all set up there. We make sure they're set up with their food, some activities. We run things over if they needed a printout for a class. We're really as high touch as we can be in making sure the student is as comfortable as they can be being in the hotel room, and it's not far from campus. So it's been working out really well, and the hotel has been a great help.